Hi, a very good evening to all of you. My name is Dr. Pritika Singh, and I am a physiotherapist and a maternity exercise specialist. And today I'm going to be talking about everything exercise related and everything pre and postpartum exercises. So, before I get into that, I'm going to start by talking a little about myself. So, I have been a physiotherapist for almost 12 years now, and I have been working with various hospitals and gyms. And from the past 2 years, I have been working with maternity health, in which I have been guiding new mothers as well as to be mothers and for various exercises and what all they should do. And it is basically a lot of counseling as well. I have recently, I think about a year ago, done a maternity exercise specializing course, which has kind of given me insight into what this is going to be about. And it is really a very in-depth analysis kind of a field, which really needs a lot of you know explanation, a lot of counseling for mothers, and it is basically a field for in which, especially who are new mothers, for them it is really a very harassing fact. So to ease them into the whole concept and make them more comfortable, and yet make sure that they are exercising and owning a healthy pregnancy while considering everything that their gynecologist suggests. So that is what this is all about. So when you talk about pre and postpartum exercises, these are all related to, these are not just breathing exercises. So basically what we are going to do is we are going to go step by step and deal with the all the options that we have and what all we can do, because especially in India there is a lot of stigma regarding what a new mother should do, what a pregnant woman should do. And our elders, rightly so, in many manners, rightly so, have guided us throughout the ages about things that you should do and not do, out of which exercise is quite not to do kind of a thing. So I just feel that exercises should not be treated like that. They should be considered a very integral part of the whole. When you look at something which is specifically for new mothers, and it should really be followed. It should really be religious. For a pregnant woman, exercising should be followed as religiously as she takes care of her diet, as religiously as she goes for her various doctor appointments. All these things should be as important as an exercise. So that is the, if you say, if you talk about the barometer of how important exercise is. So when we talk about prenatal, which is during the pregnancy, those exercises are actually divided trimester wise. Whatever I'm saying, whatever I'm mentioning is very subjective as well. So I would totally suggest that you take full guidance from your gynecologist and from whoever you are consulting. And before you go ahead with any of these exercises, you need to have a go ahead from your gynecologist. And thankfully, so a lot of our gynecologists are coming up with really they're really supporting a lot of exercising and having a healthy and active lifestyle. Uh, Till date, it has been very common that doctors suggest walk because they A, don't have the time to suggest specific exercises, and B, don't want to cut into a stigma that is still carrying on with women, that, oh, that doctor, I don't know how that doctor is, she's asking me to do I don't know, squats, and that's like a big deal. So that's one thing. इस सब के साथ ये भी बहुत इम्पोर्टेंट है कि हम इन सब चीज़ों का ध्यान रखें कि जो जितने भी लोग प्रेगनेंसी से पहले एक्सरसाइज शुरू करते हैं, वो एक ओवरऑल आपको अपनी हेल्थ के मेंटेनेंस के अप्रोच से करना चाहिए. आपको ये नहीं सोचना चाहिए कि अच्छा अब मैं प्रेगनेंसी के बाद भी पतली रहूं इसलिए मुझे एक्सरसाइज करनी है, या मेरा प्रेगनेंसी में बहुत ज़्यादा वेट ना गेन हो इसलिए मुझे एक्सरसाइज करनी है. क्योंकि हर एक जने की बॉडीज, हर एक जने की एक्सरसाइज रिजीम डिफरेंट होगी, हर एक जने की फिटनेस डिफरेंट होगी. सो दैट्स व्हाट आई एम गोइंग टू बी टॉकिंग अबाउट. पोस्ट नेटल के बारे में मैं बाद में आऊंगी, बिकॉज उसका एक बहुत सेट क्राइटेरिया है, उसका एक बहुत सेट क्वेश्चंस हैं which I will definitely address. I'm also going to take a few questions from your Q&A that you people are coming up with. So you'll have to wait up a little. So let's start with pregnancy. In the first trimester, generally, what happens is women, maybe they get to know in their second week, or maybe they get to know in their second week or second month, I mean. So depending upon when you get to know, I think that is when you should start thinking about your health and your baby's health एज अ होल. तो आपको ये नहीं सोचना है कि अभी तो बेबी बहुत छोटा है, अभी मैं कर लूंगी, एक्सरसाइज कर लूंगी, अभी बहुत टाइम है. दैट नेवर वर्क. सो एक्सरसाइज को आपको अपने पूरे रिजीम में इतना इंक्लूड करना पड़ेगा कि जब आप एक स्ट्रीमलेसली आप सेकेंड ट्राइमेस्टर में जाओ और थर्ड में जाओ, एंड देन यू आर डिलीवरिंग. सो इट हैज टू बी दैट इम्पोर्टेंट, इट हैज टू बी दैट कन्वीनियंट फॉर यू. ये नहीं कि आपने पहले दिन एक्सरसाइज करी, आपको क्रैम्प्स हो गए, आपने फर्स्ट ट्राइमेस्टर है, ओहो मैं तो फर्स्ट ट्राइमेस्टर में एक्सरसाइज नहीं करनी, मेरे को क्रैम्प्स हो गए हैं, अब थर्ड ट्राइमेस्टर में देखेंगे, बाद में देखेंगे अगर जरूरत पड़ी तो. So that is one approach that never works. So initially when you get to know in your first trimester, क्योंकि आजकल there are a lot of treatments that you're going through, somebody is going through hormones, just to sustain an initial pregnancy. बहुत कम आई वुड से कि मतलब बहुत कम मेहनत लगती है एक्सरसाइज करने में, बिकॉज बहुत कम मेहनत करते हैं लोग, क्योंकि अभी उनका मेन कॉन्सेंट्रेशन सिर्फ प्रेगनेंसी सस्टेन करने का होता है. तो उस टाइम में व्हाट इज मोस्ट इम्पॉर्टेंट इज कि आप अपनी ब्रीदिंग एक्सरसाइजेस करें, आप अपनी बेसिक जो आप एक्सरसाइजेस जो आप अपर बॉडी की ब्रीदिंग एक्सरसाइजेस, रिलैक्सेशन एक्सरसाइजेस वो करें, बिकॉज एनीवेज दिस इज द टाइम दैट योर बॉडी स्टार्टिंग इनटू turning into a baby making kind of a machine. So us time ke liye you have to kind of go easy, and a lot of people don't exercise at all, which I don't suggest. So is time mein walk karna, लाइट वॉक करना, और इस टाइम में सबसे ज्यादा इफेक्टिव होगा जब आप ब्रीदिंग एक्सरसाइजेस, रिलैक्सेशन एक्सरसाइज. विद दैट आई मीन व्हेन यू डू डीप ब्रीदिंग, व्हेन यू डू असिस्टिव ब्रीदिंग, व्हेन यू डू डिफरेंट स्ट्रेट अप योर स्पाइन. एंड I think there's a problem with the network. You just have to straight up your spine, and you just have to initially start with your breathing exercise, क्योंकि एक तरह से आपको अपनी बॉडी को उस रिदम में लाना है. Once you're through your first trimester, you're basically, as you are considered out of the woods, unless of course you have a very delicate pregnancy and your doctor is telling you to have bed rest. Then I would not suggest to go against the doctor's wishes and go for a long jog. That never helps anybody. So second trimester में आपको you should start with not just breathing but also back strengthening exercises, upper body exercises, lower back exercises, क्योंकि इस टाइम पे when you start to actually show, when you start to actually have a belly, that is the time that your back goes through a lot of changes. तो उस टाइम में अगर आप अपनी back strengthen करेंगे, and nothing very complicated, just something as simple as सीधे लेट के bend your knees and raise your hips. So that is what is called as bridging. You can just search it anywhere. Basic bridging exercises with low intensity that you can incorporate with your breathing, which you should be doing in your first trimester as well. And उसके साथ then you can include your leg exercise, because हल्की हल्की कई लोगों को second trimester में ही swelling आने लगती है. So for swelling you need to raise your foot a little, pump your feet. So if you're like lying down and you raise your foot and you pump your feet, that is a very good exercise that you need to do to reduce the amount of edema that you're having in your feet because of the baby growing. And another very important are of course relaxation exercises. Breathing exercises को relaxation से confuse ना करें. Breathing exercises are basically involving your lungs, and which actually increase your heart rate and actually give you a good flush of energy and good flush of endorphins in your body. So relaxation exercises is basically to, when you are lying down on a mat and you're meditating, and you are basically doing something for your mind that is actually thinking too much. By the time you're in your second trimester, you think too much and you're worrying about everything. So that is very important. इस टाइम पे mid second trimester में you need to do something which is very important, which is preparation of labor. preparation of labor is not a very common concept with a lot of people, and it should be, because that is what you are trying to do to prepare your body to go through a marathon that your body is going to run during labor. So it's like कि जब एक मैराथन भागनी होती है तो आप अपनी बॉडी को थोड़ा 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 करके ट्रेन करते हैं. So the time when you are going through labor, that is, you have to consider that the marathon and your body has to train for it. So उसके लिए you have a lot of pelvic supporting exercises, pelvic tilting exercises, pelvic strengthening exercises. वो सारी आपको अपनी regime में include करनी होती है after you are, of course, if you are cleared by the doctor, your gynecologist. So that is one that is very important. Once you're in your third trimester, that time though you should full swing just think about training your pelvis, because your pelvis is going to exaggerate when you are delivering a baby. So you have to train your pelvis for that. So that is what that is about. And उसमें भी ये सब एक्सरसाइजेज इंक्लूड करके यू हैव टू डू स्क्वाटिंग एक्सरसाइजेज के लिए भी आपको एक बहुत कंट्रोल्ड एटमॉस्फेयर चाहिए होता है. यू कांट गो ऑल द वे, सो यू हैव टू डू लाइक अ chair bending exercise. So like imagine you're sitting on a chair and you sit standing up and going down just to the level of the chair. So that kind of squats you have to involve, because that will give your pelvis the opening and the strength at the same time. So squats are a very important part. And there are some more exercises which change subjectively, so I would not like to mention them in general. Also, your walk and your working out, whatever breathing or whatever you're doing, has to have more intensity than it was having. So मतलब old tales हैं कि लोग कहते हैं पोछे लगाओ, और लोग कहते हैं कि when you're about to have a baby, if you have like अगर आप पोछे लगा रहे हो, घर का काम कर रहे हो, तो that is basically trying to get you to exert a certain amount. And of course, pocho mein, you can imagine the sitting posture of a pocha that basically opens up your pelvis. That is quite similar to what a squat would do, because aajkal, I mean, from a lot of people don't prefer to do pochas. So that is very important, and that is what will prepare you to a healthy and a efficient labor. And of course, if you're having a C-section or a normal delivery, it is not under anybody's control these days. You can only try for a healthy labor and a healthy normal delivery. But if it goes otherwise, there's really no need to have a block in your mind regarding that. It is basically the situation. The doctor decides, and whatever is best for the baby, वही वो करते हैं. तो उस सिचुएशन में अगर आप ये सोचो कि हाँ मैं तो इस प्रेगनेंसी में अपनी इतनी एक्सरसाइज करूंगी कि मेरा तो बेबी नॉर्मली होगा, ये अप्रोच लेना कभी भी हेल्दी नहीं होता. बिकॉज 1%, if something goes wrong, there are many complications that can happen during it. So you would approach that in a different light. तो आप उससे और ज्यादा स्ट्रेस हो सकते हो, तो which is not healthy. Okay, so now I'm going to talk about another point is postpartum. So postpartum, the 99% of mothers are मेरा पेट कम कैसे होगा. So सबसे पहले तो you should know that you can start postpartum. If you have a normal delivery, you can start about 2 to 4, in between 2 to 4 weeks. You can start your postpartum. Like you can get up, you can go for a walk. You can, again, if you have been doing breathing exercises, you can resume that. वो आप सब कर सकते हो. और if you had a C-section, तो डॉक्टर सजेस्ट करते हैं कि आप पहला महीना रुकें. You should see your condition. If you are in a healthy condition, then 1.5 से 2 महीने के बाद आप अपनी एक्सरसाइजेज शुरू करें. So ये एक जनरल आइडिया है. कोई somebody asked me कि मेरा बेबी 2 दिन का है, should I exercise? I said no. You need your body to rest and wait for a good 2 weeks to 4 weeks and then start to exercise. I mean, you can go around your basic chore. मतलब एक न्यू मदर के काम वैसे ही इमेंस होते हैं, तो आप अपना बेसिक काम करिए, बट टू थिंक अबाउट गोइंग फॉर एन एक्सरसाइज, यू शुड वेट इट आउट. एंड दूसरी बात है द अप्रोच. सो व्हेन यू हैड अ बेबी, यू शुड think about getting healthy now, because your body has gone through an immense change. और उसके बाद आपको अगर अपने आप को रिकवर करना है, तो उसके लिए आपको प्रिपेयर करना है अपनी बॉडी को. सो फॉर दैट यू जस्ट हैव टू थिंक अबाउट गेटिंग हेल्दी. तो आप ये नहीं सोच सकते कि मैं पतली कब हो जाऊंगी और मेरा पेट कब चला जाएगा. यू आर नॉट गोइंग टू एम एट वन बॉडी. अच्छा, मैं अगर आपको बोलूँ कि आपका पेट कम हो जाएगा, आप 100 क्रंचेस दिन की करें, यू विल बी हेल्दी अगेन. इट डज नॉट वर्क लाइक दैट. आपको अपनी बॉडी, आपके बॉडी में ऐसे बहुत सारे चेंजेस हो गए जो आफ्टर यू लूज योर प्रेगनेंसी वेट, यू रियलाइज कि मेरी बॉडी तो इट वॉज नेवर दिस शेप. it becomes that different. So you have to kind of come to terms with that, or gradually अपनी health के बारे में concentrate करिए, and just think about what is healthy for you right now rather than what will make you thin or what will give you other options. Okay, so I hope I have given you a good idea of what I'm talking about. Once you are out of the woods, about 2 months after your delivery, you can basically do all kinds of exercises. You can basically run, jog, whatever works for you. Yoga, aerobics, Pilates. Pilates, I don't know. Pilates, not so much, but I mean, you can do a lot that you could have done if you were not expecting pre-pregnancy. So that is what the general idea about it is. Now I'll be taking a few questions. So here, okay, so Supriya has asked me, when can I start my postnatal exercise? So Supriya, I would have to know that anyways, in general, if I would like to tell you, if you have had a normal delivery, then you can start anytime from 2 to 4 weeks, definitely with consultation from your gynecologist. And if you have had a C-section, then 1.5 to 2 months later, you can start your exercising, and definitely consult your gynecologist for that, because that would be the best solution. Again, okay, Naval Kapoor has asked me, can it be risky to do exercises in the third trimester of pregnancy? No, it is not at all risky unless you have had a high risk pregnancy in which you've been suggested to do bed rest. In that also you can do basic, sitting on the bed breathing exercises and toe movements and or basic exercises still you can do there. But no, it's not at all risky. Okay, so now Supriya is asking me, can we do exercise with low-lying placenta? So Supriya, in low-lying placenta cases, there is generally the doctor suggests bed rest, and if you have been suggested bed rest, then you have to take the doctor's call on it. If they say that you are on bed rest, but you can do breathing exercises and you can do like leg movements and everything, but if you have been strictly put on strict bed rest and no movement, then I would not suggest to take that risk. Still, you can do your breathing exercises, because that is basically just sitting on the bed and doing proper breathing and not exerting any pressure on your placenta or your fetus. So that can be done. Virajshri is asking me, hi, I am having twins and I have completed 26 weeks. My concern is that movement of my one baby is very active while the other baby hardly moves. Is there anything to worry about? That is, I think, a very you should also ask your pediatrician about it. But that is also a very baby thing. Every baby is different, even though they're twins. So I think you should consult your pediatrician and still take it easy, not worry about it too much. So, सुरेंद्र मोहन has asked me, hello मैम, मेरा बच्चा 2 दिन का हुआ और मेरी वाइफ को कब से एक्सरसाइज करवाएं? सुरेंद्र जी, I think your wife would be much happier if she would decide on her own when she can exercise. So I would think कि वो जब वो थोड़ा healthy feel करें, अगर उनकी normal delivery हुई है तो 2 to 4 weeks, और अगर उनकी pregnancy cesarean section हुआ है तो 2 महीने बाद वो exercise कर सकती हैं. बाकी वो अपने normal काम कर सकती हैं. और I think exercise के लिए right advice मैं उनको ही दे सकती हूँ, और she only will be able to judge कि मेरे लिए क्या सबसे appropriate है. Okay, so Priya is asking me, can we start exercising during pregnancy? So Priya, never, even if I've never done it before, yes, you can start. It's never too late, but you'll have to start with a very low intensity. So like if you are doing breathing exercises, you just do it for 10 minutes. If you're doing, if you're doing hip strengthening, or if you're doing squats, you do very low repetitions. You do very like 2 sets of 5-5. So very gradually you have to start. So basically that is what you have to do. You have to build your body to come up to the level of being able to strong enough to go through the beats of labor. So yes, of course, you can very much start and gradually build your strength. So someone else has also asked, if I have never done exercise, can I start in pregnancy? Yes, you can very much start breathing exercises. It's never too late. The stronger your lungs are, the more blood perfusion will be in your body. So that is very, very important. So Someone has asked me normal delivery के लिए कौन सी exercise करते हैं. I have already spoken about this कि normal delivery के लिए कोई exercise हो, I would not say that. Exercise करके you can only hope that you have a normal delivery. उस time पे क्या circumstances आते हैं, you really can't judge. Having said that, you need to train your pelvis a lot. You need to train your back a lot. You need to really do a good amount of squats, a good amount of pelvic tilting exercises, cat camel exercises. There are a whole range of exercises that you can include, and that would come out really well if it. The cases that I have come across, it has always helped. Having had a good exercise background during your labor. Okay, so no, Rachel is asking me what is the correct posture for back pain. So actually, posture is also a whole other stream of discussions. Posture correction and posture for back pain would be, if you have back pain, then your posture is gone. So you cannot even think about your posture. So what you have to think about basically is all the little things that are, you can correct while you are standing in front of a mirror. So posture is a lot about feedback. When you're standing in front of the mirror and you see yourself slouching, automatically you should think about erecting your spine up and standing straight, thinking of both your shoulders to be at the same level and appearing better. So that is what the whole point is. So posture for back pain would be a well supported back, because that is what makes a back pain worse if the back is not supported well. And yes, of course, standing straight and putting the right amount of pressure on your back. And once you have a pregnant belly, then in that case, not slouching too much, because what happens is when you have the lower back is protruding inward, your upper back slouches, so you have to kind of correct that consciously. So that conscious effort to correct your back posture will also really help. Okay, so which is the best one to start exercises during pregnancy? As I said, you can start right from your second month of your pregnancy, which is basic breathing exercises. You can take a walk, you can do lying down exercises, you can do pelvic exercises, you can do cat camels. All these exercises you can very happily do, because this is because that is how you train your body gradually. So I would suggest that, having said that, if your doctor does not suggest, he says that your pregnancy is still very weak, still very fragile, you can wait it out and very well start in your second trimester. So Rachel is, can you suggest anything for back pain? Rachel, it depends upon the kind of back pain. I would suggest you to go to a practitioner, physiotherapist probably, who will have to assess you the cause that the back pain is from. And also, what I would genuinely suggest is postural correction, because that really, really helps in back pain. So it's actually kind of a vicious circle, because your back pain spoils your posture, and then your posture becomes bad, and then that increases the back pain further. So you have to kind of figure out a proper somebody to assess you in person, and that person will be able to tell you better. Lakshmi Mishra is asking me, how often should a pregnant woman exercise? She can do it twice a day, as much as that, yes. Breathing exercises, relaxation exercises, she can do twice a day. If she's doing anything hardcore, and if she's doing like literally training her lower body, her back, she can do that once a day. It's basically upon how much your body can take, and not overexerting yourself, yet exerting yourself enough. That's kind of a balance that you kind of have to figure out yourself. That's my doctor in the back, by the way. How often should a so yeah, those were all the questions. If you have any more question, I would most be happy to know. Apart from that, what I would like to talk about is post-baby wellness. So a mother who's once delivered a baby has to go through a lot of changes in her body. And once she's done that, she should only aim at being the mother for the initial 6 months, I feel. So once you've had a baby, getting back into shape and looking a certain way and losing a certain pound should not be your concentration initial 6 months of your pregnancy, because you're also a new mother, you don't know how it's done, so you are also figuring out something that is absolutely new. So those initial 6 months should be of self discovery, they should be of finding out कि ये करना कैसे है. सो आपको जब तक वो समझ नहीं आएगा आप एक हेल्दी मदर, एक हेल्दी ह्यूमन बीइंग नहीं ही बन सकते. सो आई थिंक दैट इज वेयर यू शुड स्टार्ट. एंड हैविंग सेड दैट, आपको आपकी बॉडी खुद बताएगी कि मेरी ये कैपेसिटी है और मुझे इतना करना है, और ग्रेजुअली ही उसको आप बढ़ा सकते हैं. सो दैट इज हाउ योर बॉडी विल काइंड ऑफ गिव यू अ फीडबैक कि मेरे को ये प्रॉब्लम्स फेस हुई जब मेरी प्रेगनेंसी में हुई थी, और अब इसको रिकवर करने के लिए मुझे ये स्ट्रेंथ की जरूरत है. तो वो आपको एक बैलेंस खुद बनाना पड़ेगा. So I just suggest that once you had the baby, once you are very comfortable and you've enjoyed your pregnancy, you should just go ahead and kind of be confident and not think about getting thin. A lot of people actually talk about getting thin, and I don't think that is the right approach. It was great talking to each one of you, and I was glad I could hear all your questions and answer a few of them. I hope I was of some use. Please follow me on BabyChakra app. My name is Pritika, Dr. Pritika Singh, and please follow me. And if you have any questions, I'm available. I would be happy to answer. And I have on my page there is also my code which you could take up for buying products of BabyChakra and other all mom related products. So let me know, and it was really fun and really nice to talk to all of you. Thank you very much. Good night.